Syphilis is caused by Treponema pallidum, which is a tightly coiled spirochete and is gram-negative. It lacks the enzymes necessary to build many complex molecules, therefore it relies on its host for many of the compounds necessary for life. It produces several lipoproteins that induce an inflammatory immune response, which causes the tissue destruction of the disease. The organisms rapidly enter the bloodstream and invade deeper tissues. Syphilis was once a major public health threat, causing serious long-term health problems, such as arthritis, brain damage, and blindness. According to the CDC, the rate of new cases of syphilis dropped in the 1990s and reached an all-time low in the year 2000. However, new cases of syphilis doubled between 2005 and 2013.
This disease is transmitted from person to person by direct contact with the syphilitic sore. These sores occur mainly on the external genitals, vagina, anus, or in the rectum. These sores can also occur on the lips and in the mouth. Transmission of syphilis occurs during vaginal, anal, or oral sex. The incubation period averages 3 weeks but can range from 2 weeks to several months. One of the most dangerous forms of syphilis is called congenital syphilis. Pregnant women with the disease transmit it across the placenta to their unborn fetus. This type of infection is most common when pregnancy occurs during the latent period of the disease. A pregnancy during the primary or secondary stage is likely to produce a stillbirth. Healthcare workers are at risk if a cut on the skin comes into contact with a syphilis sore. Because syphilis bacteria are extremely fragile, they are not spread by contact with toilet seats, towels, eating utensils, bathtubs, or swimming pools.
The symptoms of syphilis are defined in 3 stages. The first stage, the primary stage, consists of the cankers, which are painless sores that form around the lips or in the mouth. They are highly contagious and occur between 10 to 90 days of exposure, but they will heal in 6 weeks without treatment. The secondary stage consists of a copper penny rash that is found on the palms of the hands and soles of the feet, also a very highly contagious stage. Other symptoms include hair loss and mild fever. Between the secondary and tertiary stage, there is a latent phase. In this phase, the infected person will be asymptomatic. If the person remains in the stage for 2 to 4 years, the disease is not usually infectious. The tertiary stage is classified by the affected tissues and types of lesions. Gametosyphilis are characterized by gammas. They affect the skin and mucous membranes. Lesions of the mucous membranes can lead to death because they abrupt the organs. Cardiovascular syphilis and neurosyphilis are rare types of syphilis and are usually not seen.
Depending on the different stages of syphilis, the diagnosis can be determined through 3 different tests. The first is visual microscopic inspection. It is used to screen primary syphilis. Antibodies take 1 to 4 weeks to form. Sometimes the use of a dark field microscope is necessary. This microscope detects spirochetes and is also able to view poorly stained bacteria. During the secondary stage, spirochetes invade most of the body's organs. This is a good time to run serological tests. Non-treponemal serological tests are nonspecific and do not detect antibodies that are against spirochetes. However, it does detect region-type antibodies. The test detects 70 to 80% of primary syphilis cases and 99% of secondary cases. An example of this is a slide agglutination venereal disease research lab, or VDRL test for short. The newest test is an ELISA test. A rapid diagnostic test, which is done in a physician's office, is also used. The final test is a microscopic examination of lesions. The antibiotic treatment that is used is penicillin. It remains in effect for 2 weeks. If a person is allergic to penicillin, there are other antibiotics that help treat syphilis.
The number one way to prevent getting syphilis is to use condoms. If you are with someone who has previously been infected or who currently is infected, it is recommended to restrain from any sexual activity, especially if they have any open sores. STD testing is a great way to know if you have syphilis and if you do, to treat it immediately so it does not progress.